Hello friends, let us now learn some important points about chest x-ray. And in the chest x-ray, if the patient, normally the patient has to take deep inspiration while we do a chest x-ray. Deep inspiration is necessary like this. Deep inspiration, if there is deep inspiration, the distance between the two rib spaces will increase and the diaphragm will actually, whenever we take inspiration, the diaphragm will pull downwards and the heart is attached to the diaphragm. So along with the diaphragm, even the heart is pulled downwards and the ribs are pulled both at transversely and also they are pulled anteroposteriorly. So as a result, the intercostal spaces are widened when we take full inspiration. Okay, but there might be some conditions where the patient took shallow inspiration. That is, he did not take full inspiration. On seeing the chest x-ray, when can you say that the patient has taken shallow inspiration? We can say that the patient has taken shallow inspiration if at least 6 ribs, these 6 ribs should be anteriorly. 6 anterior aspects of the 6 ribs, if they do not lie over the dome of the diaphragm, that to left dome of diaphragm, then we call it as shallow inspiration. That is, if this is the chest x-ray. So this is PA view, this is also PA view. If you see here, how many ribs are there? This is first rib, anterior aspect of the ribs is what we should see. So this is anterior aspect of first rib, then anterior aspect of second, third, fourth, third. First, second, anterior aspect of third rib, fourth rib, fifth rib, sixth rib. This is anterior aspect of seventh rib. If at least 6 ribs, anterior aspect of at least 6 ribs are visible, then it is normal inspiration. So this is good inspiratory film. But if you see here, this is the first rib, this is the second rib, third, fourth, fifth. The sixth is not visible. This is sixth. It is not, it is not above the dome of diaphragm. It is below the dome of diaphragm. If there are less than 6 ribs above the dome of diaphragm, then we call it as shallow inspiration. Ideally, we should look it at the left dome of diaphragm. So if you see here, 1, 2, 3, 4, 5 and 6th is here. So 6th is below the dome of the left dome of diaphragm. So as a result, so this is shallow inspiration. Okay, so this is the fill which is shallow inspiration. Now, what are the causes of shallow inspiration? This shallow inspiration is seen in elderly patients who cannot inspire properly, or if the patient is in pain, obviously he hesitates to inspire deeply. If the patient is unconscious, obviously you can't tell an unconscious patient to inspire. And in bedside radiography, why? Because in bedside radiography, actually the patient is in supine position. If the patient is in supine position, then it is very difficult to obtain the, if the patient is in the supine position, then the patient faces difficulty in taking full inspiration. So, in all these conditions, the patient can have shallow inspiration. Now, what is the problem of this shallow inspiration? See, if the patient takes deep breath, okay, if the patient takes deep breath, then the intercostal spaces, that is the spaces between the two ribs, are more increased. But here, the spaces between the space present between the two ribs is less. So this is called as crowding of ribs. So crowding of ribs will occur, number 1. Okay. Normally, if the ribs are away from each other, the bronchovascular markings are lighter. Whenever the ribs are crowded, that is, the rib space is less, then the bronchovascular markings overlap on one another, and as a result, they look darker. That is, there will be crowding of vessels at the lung bases is seen. There is, because of crowding of ribs, there is also crowding of vessels is seen at lung base. So this can be sometimes mistaken with either infection or any other types of diseases. So always look at the number of anterior ribs. If they are more than 6, then it is normal or good inspiratory film. If it is less than 6, then it is shallow inspiratory film. Or it is in shallow inspiratory film, the because the pull of the diaphragm, actually in full inspiration the diaphragm is pulled down, so even the heart is pulled down, so the heart size is a little lesser, like that is transversely the heart size normally decreases because of the pull of diaphragm downwards, but here the pull of the diaphragm downwards is absent. Pull of the heart by the diaphragm downwards is not present. So as a result, there is increased transverse diameter of heart is also seen. The transverse diameter of the heart is also increased. So wrongly, the mediastinum appears widened when the mediastinum is actually normal. Okay, so this is one important problem about the shallow inspiration. Thank you.